Hey everyone, welcome to the Facebook Live today. I've got Ben Blecha from Go Hero Braces, and we're going to be having a discussion today, just chatting about style for braces in general. So if you guys have any questions, please put them in the comments box. We're going to chat about all the questions that you really want to know, and maybe the things that your clients will be asking you. And I sort of wrote down a few things that I wanted to ask Ben about. But we really, really love your feedback. So guys, if you want to know questions, even if you're watching this as a recording, please just put them in the comment section, any questions that you have for Ben, and I will get Ben to go afterwards and just check maybe over the next 2 days just to see if there are any questions or so. So welcome, Ben.
Thank you. Thank you.
Awesome to see you again. The last time I saw you was in Knoxville.
Yeah, it's been a couple months now, right?
Oh, I know. Crazy, crazy. How you doing? Have you been going to loads of conferences? You've been busy.
Yeah, this is like the busy time of the year for holistic conferences, like boom, boom, boom. So through the end of November or through the middle of November, and then we're done for the year. So
okay, that's good. So you can have a little break because you travel a lot. Whenever you and I communicate, you're always about to get on a plane or something. You know, you're traveling somewhere, at a hotel somewhere.
Yeah,
Must be hectic.
trying to teach a lot. I mean, that's the best way is just letting people understand how to use the brace, and that's really the hang up. People understand that it's useful, but it's scary in a way. So like, how do we fix all those and get through all those things? So yeah, a lot of time on.
What do you find the most common things that people are worried about? Whether it be a pet owner, I'm sure the things the pet owner are worrying about are the same that the rehab therapists are worrying about.
Right. I mean, the unknown generally to start with, which, I mean, the thing about bracing is it's relatively new to veterinary medicine, so it hasn't been taught in the schools. So like you got to practice spaying cats, over and over in school, but you didn't get to practice bracing over and over. So it's kind of practicing it live in your practice, and so there's some things like the casting is often scary to people because it was taught in school, but we don't use casting as much in our practice. And the nuances of casting for a brace are just a little bit different because, with a fractured cast, we're trying to hold it in a position and we're trying to pad it so we don't have skin breakdown. But with a cast on a brace, we want to see every little nook and cranny. So we want to wrap this cast really tight. So there's kind of some counterintuitive things that go on with the casting, and we just try to work through those and explain why we need to do them.
So can you just run through the procedure? So for somebody who has absolutely no idea how the end product is actually formed, the procedure and how you would go about from dog to the brace.
Right. So, I mean, we'd like to think it's like we go pick out like 5 sizes like a t-shirt, right? And this is the size that we put on a dog. The problem with that is if you or I were to tear our ACL, there's 14 different sizes of knee braces for humans. Okay, that's just for adults. So take that number and multiply it times the number of breeds of dogs. We'd have to have so many different sizes. And even if there was some overlap, there would have to be a lot of different sizes. So how we get around that is we actually make each brace custom to each dog. And in order to do that, we have to take a cast of the leg. And that cast is it's on for about 15 minutes and then it's removed and then it's shipped to us. And then we actually make a model of the dog and we make the brace for that dog. And that reduces a lot of these scary things about fitting issues, it might rub somewhere. It can still happen, but it reduces it dramatically by making them custom to the animal.
So you actually make, hi guys, I see there's a few more people online now. Welcome. We're talking about style for braces. If you have any questions, just pop them in the comment section. So when you say you actually make a model, so you actually make like a leg, and then you can, after you've created the brace, actually put the brace on, fit it, so you know exactly what shape and what the dog's leg that you're making that brace for is.
Yeah, so like for a hawk here, this is a cast of a leg. And what we do is we seal this up, that it's cut off, but we seal all this up, and then we fill it with plaster. And then we peel this cast off, and we actually have a model of what the leg looks like. And from that, there's bony areas, right? And so we don't want this bony area to rub. So what we do is we create a cavity around that area so it won't rub. And so we build up plaster in that area. And so we change the shape to fit the anatomy. And then what we do is we take great big sheets of plastic, and we heat them up in the oven, and then we drape it over the top of that model, and vacuum sucks it down to the shape of that animal. And so it's precisely made to that animal's body.
Yeah. Okay, so one of the things I wanted to chat about, so although it's custom made, there are problems every now and again with rubbing and it being uncomfortable. And obviously, every dog is different. So it depends a little bit on their temperament and how well they'll tolerate it. So one of the things as a therapist, you're not really sure from the beginning. I mean, sometimes you know that this dog is just not going to tolerate a brace. They've just got that type of personality. But other times you may be not so sure. And then you get the owners to make this leap to get the brace. And then the dog doesn't tolerate it. What would be the reasons? Is it because that maybe it's rubbing them uncomfortably, or is it just a personality thing that they just don't like something? You get those dogs that they don't like harnesses and jerseys and things like that.
Yeah, it's with anything. If you don't understand how it's helping you, you aren't going to use it. And with the animals, we can't sit and have a conversation and say, hey, this is going to support your knee, so you should do it. So we have a lot of times what we have to do is we have to do tricks, and that's where the therapist comes in, is teaching the dog how to weight bear on it. Because anytime they've had an injury, they've already created a habit of how they're walking and their gait of not weight bearing, right? And so to break that habit is tough. Even if all things are fixed, they will still have a tendency not to weight bear because that's already ingrained in their neural processes. So the therapist really has to come in and has to do gait training again, weight shift training to help the dog understand. And generally, as soon as they understand, they will start using it more quickly than humans actually, and start weight bearing. If we've gotten past that in the training, that generally will happen depending on the dog from 2 minutes to 2 weeks, right? And then it depends on how well we are training. We all know that some people are better at training than others with the animals. But if we get past that time and it's not still working in that way, we're not seeing the weight bearing that we like. There can be fitting issues. Generally, there's a fitting process, and when you first put the brace on, you wear it for a half hour, and then you take it off, and you check in and see if there's any rubbing areas, and then you double that to an hour, and double it to 2 hours, and double it to 4 hours. You can get to 4 hours. It's probably not a fitting issue if you don't see that skin rubbing. But if the dog, is talking to you, if they're looking back at the brace and they're saying, hey, this doesn't seem right. And so then what we do is we'll do a FaceTime, and we'll actually see live and see, well, how is this fitting? Is everything in position? A lot of times it's just how the owners are putting the brace on. So the owners in their mind say, well, I don't want this too tight. It's going to hurt them if it's too tight. And then that's, again, another counterintuitive moment, because if we have a bone, say right here, and we have the plastic cupped around it, and if it's loose, it will shift up and down, and the plastic rubs on the bone, right? But if it's tight and it's holding it in the position it's supposed to, and we made it the shape that we need to, it won't rub on it, and we won't actually have that rubbing. So, there is a fine balance. You can get it too tight, and we all know that when we have a shirt or pants or a belt that's too tight, right? And so that is a real problem, but it's generally not the problem of fitting. It's generally that they've gotten it too loose. So always when we go and when we're trying to find out what the issue is, why they aren't doing it, we actually watch the owner put the brace on, because we all have the tendency to, well, I'll just put it on. Well, see, it works fine. Well, I've put on thousands and thousands of braces, and so seeing how the owner is actually putting it on is really important in your clinic and being able to decide what is happening. So yeah, and with if there are fitting issues, the braces are made out of a plastic that's heat malleable, so we can change the shape. We don't have to remake a brace. It's just a matter of finding out what the core issue is. So
now your braces with quote. Was there a bit of echo there for you?
Yeah, there was just a bit.
Is it all right now?
Yep.
So yours don't have a lining of foam inside. So they just, I've seen some braces that actually have foam lining inside. And yours don't. Is that correct?
Right. So what we do have a padding, but it's a removable padding. So it's made out of, has a neoprene inside, and then it has a Velcro surface. And so going back to the brace shifting around and not holding on the body, with the fur, if you try to hold on to it, it's very slippery. So it's tough to hold on to an animal. It wants to shift around just because of the fur. Where on humans, if we try to hold on, the skin has more friction on it, and so when you hold it, it kind of holds in place easier. So with animals, we actually have to do some tricks of using the geometry of the body. So for example, like here on the hawk, we can see that it's wider here than it is up here. Okay, so if we actually put this neoprene band up here and wrap it so it's tight enough that it won't slide down past that, then we can Velcro the brace to it and it keeps it in place. Okay, so our padding we actually use as a suspension method as well. Okay, so we wrap this padding on first, and then the brace Velcros to it, and then that keeps it from shifting around and causing those issues. The other thing with padding that, again, another counterintuitive moment is we think that if we put more padding, it's softer and it's going to feel better. Okay, and a lot of padding actually has a very, very high coefficient of friction, which means that it sticks to things very well. Okay, but the thing is that when it sticks, and if the brace is rubbing around, it will actually cause skin breakdown. It will rub a sore. So I'm actually an amputee, so I had osteosarcoma when I was 16, and I have a prosthesis that goes up on my thigh. And the whole prosthesis does not have any padding in it at all, okay? All I wear is one single sock that's in between that actually makes it so it's smoother, because that plastic or the foam actually rubs a sore. And I've had prostheses that had a lot of padding, and they're actually rub sores all over my leg. And since I've gone to something that has a smooth plastic surface that the fur can slide over, then it doesn't rub the same. And so if you look at our stifle brace, we don't have any padding at all in the thigh area. And the reason that is the thigh changes shape dramatically through the range of motion. And so it's going to shift back and forth in this thigh section. And if we have padding in there, it will actually rub a sore, or it will cause the brace to shift around. And so we actually want this very smooth in the thigh section on our brace. So it, again, counterintuitive things, but in the end, it's more comfortable, and I can vouch for it personally. So
it's great that you've got the experience. We've actually got a few questions that have popped up. Somebody actually was just a statement. They wanted to say, when they have a brace and they put it on their patient, they usually actually keep them in the hospital for one day, and they do all the checks first, and then they'll discharge them. Somebody asked, what would be the indication for stifle braces? In the case of cruciate rupture, would it make sense to brace the contralateral leg during retraining to help prevent overstraining the healthy leg? So it's sort of two questions. So when would you use stifle braces, and have you used them to prevent a tear on the contralateral side?
Okay, so let's start with the first one. So so my training is in human prosthetics and orthotics, okay? And so in human prosthetics and orthotics, if we have an ACL tear, we do surgery, we do a brace, we do rehab, the whole things. But insurances generally pay for all of those. So when we get into veterinary medicine, when I first came 13 years ago, I thought, well, this is, people will just transition. It's going to work great with rehab. And, this is this perfect Zen world. And really what I find is 98% of the people that use cruciate braces are for non-surgical dogs. So we see more of a conservative management. I can't really do anything but maybe afford some meds. We have bracing somewhere in there, physical therapy, conservative management, and then we have surgeries, and there's a whole gamut of surgeries, right? So basically the owners choose from one of these certain levels, right? And, I would say that, physical therapy or physio is going to help all the levels better, but it's kind of bridges all of them. But so that's kind of the choices that we have in what we're doing. There are some surgeries that I think that could be helpful to do surgery and a brace. So if you think about like the extracapsular surgeries that you have, some sort of element that can break, and for those larger dogs, that you're not going to do that surgery on. You could do the surgery and brace to help support that, so you can raise that bar a little bit. We've seen a few people dabble with that, but that hasn't been adopted a lot yet. I still think it could be beneficial, but primarily what we're seeing is for the 10 to 12-year-old dog that may have a comorbidity, and they need some sort of support because they can't have surgery. So would you agree that that's what you're seeing where you're at?
Yeah. If I think of the braces that I've done, like you say, probably 90% for that conservative management. But I have done a few actually for dogs post-operatively that haven't recovered well, or there's been a post-operative complication. And then the owner has decided not to go for surgery again. So whatever the complication may be, so it might be a TPLO, there was a problem with infection or something like that, they've had to remove the plate, or whatever. Either they use the brace to support the area during the time post-operatively, or they just decide, well, they're not going in for another operation and they're now going to use a brace. And I must say, every single time I've ever used a brace, it's always been successful. So I had one or two cases that didn't tolerate it well initially, but very, very quickly they got used to them. And the owners, I've never had an owner that ordered an orthotic, stifle orthotic, and was not happy with it. They always had very good outcomes. So let's chat a little bit about that contralateral limb, because I think that is a problem. And I actually had a case that was operated on the one side, and then probably a year later, I saw the dog maybe for like 3 months of rehab, and then they stopped completely. And it was an elderly dog, and then it ruptured the contralateral side, and then they didn't do the operation on that side and just got a brace. What did you think about using it as a conservative method to prevent the contralateral side from rupturing, just in that time where you're doing rehab initially?
Yeah, and we already know what 60, 70, 80%, depending on the study, the other side is going to tear. And so like we always look at that, like how can we bring that number down? And I do think that's a very valid direction to go and look at it. The only reason I'm balking is that I don't have enough people that have done it that I can say confidently that, yeah, this works, right? to me, it makes sense to try it.
Yeah.
But I can't give you more than that. Like I'm pretty confident in helping the non-surgical dogs. I've just seen so many of them be successful, right? But I haven't seen enough people try that, and I'm not sure why, because I mean, if you spent that, I mean, money on a surgery, I mean, I think you would know that you don't want to spend it on the other, or maybe you don't have enough money to go on and do the other. I'm not sure why people aren't trying it, or if it's just we haven't talked about it enough. That could be part of the problem too. And so this is a good venue to talk about it. So
if you think about those cases now that have operations and that you're using the brace for, so you do the op and then you actually brace afterwards. Maybe it's actually just bracing that side, so they have a little bit of support, so the rehab is quicker, and they don't have such an altered gait that they causing problems on the other side. So yeah, it's one or the other. Which one do you actually brace? But I guess what you'd need a surgeon who had stats of a whole lot of cases. So let's say he did 100 and he knew what his stats were. So what his percentage of contralateral ruptures were. And then you had to get him every single case that he did to brace the contralateral side and then see what his stats were. So that's your challenge, Ben. You've got to find something.
Yeah, we have so many studies that we want to do, and I mean we're working on a few, but it's like you gotta have these 3 studies done before you can do these 3 studies, and yeah, basically like you're saying, you have to have this whole study of what my statistics are, and then the next question I have too is, so right now most of the surgeries we're measuring at 6 or 12 weeks. Well, what's happening at a year? And so can we start stretching those as well? And how does rehab and bracing help at a year? I mean, because we feel pretty confident in the surgeries at 6 and 12 weeks, right? But what's going on later than that? Because there's more after that. So.
Yeah, I actually did a podcast with Leilani Alvarez the other day, and we were chatting about research, and I love it. I have all these hypotheses which I'd like to prove. Just no time and access to be able to do all of them. But one day I will. It's on my bucket list. I will do some clinical research, and I'll let everyone know once I've done it. We've got lots of questions coming in. Here's another one. What about dogs that have multiple other orthopedic issues, such as hip dysplasia and luxating patellas, as well as a cruciate tear?
Yeah.
So are those good candidates for an orthotic?
Well, I think so. So, I mean, first, I don't believe bracing will help a luxating patella. Okay, the patella is too small, and just to be able to hold on to it for an extended amount of time with enough force would cause skin breakdown. So like, I don't believe that bracing can address that. But when you have several comorbidities that are going on, at some point the animal just says, hey, I'm just going to chill out and sit here, bring me my food, right? And so we have to look at what we can stabilize the best to keep them going as much as we can. We know that if they keep their body moving, their life will last longer, right? There's so many other functions that start shutting down when they quit moving. And so, yes, I think that we need to look at what do we best stabilize it. And when I start looking at those complex cases, like I usually ask for video and say, okay, where can we best help to keep them going? We know that we can't get them into a perfect gait. We can't do all these things, but how do we keep them moving? And yes, I do think that there's merit for those cases. So.
I think especially with cases that have hip dysplasia as well as cruciate ruptures, I think part of the reason that they rupture the cruciate is because of the hip dysplasia. They have muscle wastage, which contributes to internal rotation of the stifle. And I find, I must say, that doing strengthening and therapeutic exercises and, doing rehab on those hip dysplasia cases, I found quite rewarding. So I think that if you could stabilize the stifle and then do that and try and help to build some muscle over there, you'd help with the hip dysplasia quite a lot. So I've used orthotics in cases that have had hip dysplasia. The luxating patella throws another problem in there. But I've also seen with dogs with severe muscle wastage suddenly have a luxating patella. With once you strengthen them, that seems to stabilize a little bit. So,
right.
Hey guys, I think there are loads of you online. We're getting lots of thumbs up and lots of hellos. So just saying hi to it again. If you've got any questions, please put them in the comments section. We're having a great chat here with Ben. I've got another question for you, Ben. I have a large tripod golden who lost his first leg to TPLO complications. So when he tore his remaining cranial cruciate ligament, owners opted to have an extracapsular performed with bracing used additionally during walks and playtime to try and minimize the chance of failure of the extracapsular. I think it was just a statement. So right. She was just letting us know. Yeah, that's awesome. So some of the things that I wanted to chat about was, when you were talking about the rubbing, are we just looking now to see, first of all, we're going to see that there's loss of hair, and then we're going to start seeing redness. So what would the very first sign be? I mean, with the cases that I've had, I remember the one dog was biting at the brace, and we really knew. And then I had another one that was just started, actually. I just started noticing that the hair started to get a bit spiky, and they started to rub away a bit. What other things would we look out for on the actions of the dog, or specifically like redness, hair loss? Is there anything else?
Yeah, so those are you've covered the main things that we're looking for. When I was in my human practice, obviously we can see our skin much easier, and oh yeah, that's right where it's at. But what the thing was is that I had to coach people to. Just because you see redness doesn't necessarily mean that it's a rubbing issue or a problem. If the redness doesn't go away in about 20 minutes, then it's probably going to be problematic. Your skin can blanch and some of those things that can happen. There are also the other side is that there's also more fair-skinned dogs. That will, and it's important for those dogs to understand, because those more fair-skinned dogs, you take it off and like everything looks red, and you're like, this thing's on fire. And those dogs, oftentimes it will subside in that 20 minutes. Or when they say toughening up, those are the ones that you kind of look in. Is this going to be an ongoing issue? I mean, is it problematic? Do we start to see callousing later on? That's you can see that within a week or so. If we start to see some callousing, that's probably a high pressure area that we should take care of. But if you're not seeing that and the redness continues to go away, redness isn't always an issue that way. So.
That's good to know. And Ben, if you have a case that has a lifelong, so it has to use this brace lifelong now. So let's say it's a 12-year-old ruptured his cruciate, you decided you're not operating. How often would you need to replace the straps and things like that? So just having an idea just for maintenance-wise, so that you could manage expectations with the owner.
Right. So generally straps, depending on, some dogs are only on the home, some are playing in the backyard, the mud puddle. Generally, most straps will last at least 6 months. And we see them last upwards of 2 years. And that's generally, and we have a minimal replacement fee and basically refurbish the brace and make it somewhat basically like new in that. But back to your point of a lifelong wear for the cruciate, at least what we see, you think about if you're going to do conservative management, you start to have medial buttressing and it stabilizes. You'll still have intermittent lameness throughout life. I think you see that with surgical dogs as well. But what we see with the brace is we stabilize the knee or the cruciate or the stifle for about 6 to 9 months, and we bring the dog back in and we check to see if we're having that medial buttressing and that we're stabilizing the joint. We know it's not going to be as strong as what the Cruciate once was, but at that point we generally start weaning out of the brace, and we only wear the brace at high activity times, like you're going to go on a 5-mile hike, something like that, or during that intermittent lameness. Okay, so we want, when they go intermittently lame, we want them to start weight bearing quickly so we don't tear the other side again, and get them, you know, in those proper gait habits. So we have had doctors report in doing this way, even with the medial buttressing, that the medial buttress doesn't seem to be as big, and even though they've stabilized it. And so what we think is happening, and then this is going back to our studies, what we think is happening is that because we're stabilizing it during the buttressing point, that buttress is tighter and it doesn't have to be as big, because we don't have the constant cranial drawer motion and waiting for that to buttress down. So that's the theory at this point of what we're seeing. So.
Now, so one of the thoughts that I had is, you know, especially for those cases, is to decrease the progression of osteoarthritis in the joint. And I wondered whether using the brace would provide that stability to slow down osteoarthritis. I guess it's another study maybe that needs to be done. But that's my thinking, you know, like, I mean, we know that surgery can slow down the progression of arthritis compared to a dog that doesn't have surgery. And the reason is because we're providing some stability. And my thinking is that that's exactly what the brace is doing. It's also providing stability. So could it actually slow down the progression of osteoarthritis in a case that is operated on or not operated on, for that matter?
Right. And I mean, it's the same thought process as the surgery, right? If we limit the cranial drawer, then we limit the inflammation that causes, arthritis is inflammation, right? And so it's the same basis thinking. But again, like you said, we need a study. I stand here, throw spears at me.
All people listening out there, guys, come on, get involved in research. We're giving you loads of ideas now, so you just got to get some funding, and let's get going with all these ideas that we're having.
And we do help. We do work with people that want to do research. So we'll help supply braces and whatnot. I mean, there's a level. We can't fund everything just for IRB things and things like that. But we will help you. I mean, we want to know too. I mean, if you look at the braces that we made initially, you kind of scratch your head and say, "What were you doing?" But it's an iterative learning process. And I mean, we had a study that was done at Georgia on healthy dogs who they weren't Cruciate deficient, but it opened up more questions, and so we can continue to learn what's going on. We do see good outcomes, but we're always learning. So.
I've got one last question. I don't know if any of you guys are listening. If you've still got questions, post them in the comment section. But my question is about, you obviously have the hinges on the side of the brace, and that, that you can control how much you can flex and extend the joint. So we know that it's painful for dogs that have cruciate ruptures when they extend it. So do you actually limit the extension that they're allowed on those joints? Or how do you set that?
Well, so we don't actually in our design. It probably does to a point. So these joints are made out of kind of an elastic. So I mean, once you start getting to full extension, it starts to get a little bit more rigid. And so in my mind, when we first put the brace on a dog, the dog usually doesn't flex the stifle very well in it. And it's not because it can't move. I'm moving it fairly simply. It's because they don't know how to move in it. So I don't think that they fully extend in the brace that way, just because that range of motion stiffness to it. So
doesn't happen. So somebody asked a question. They said, would you ship to Ireland if any studies were done here?
Sure. Yeah.
Yeah, he says you will. Cool. Ben, it's also awesome to chat to you. I know you and I can always chat forever, but our time has come to an end. So thank you so much. Looking forward to seeing you at WebCon. For those of you that don't know, WebCon is our virtual veterinary rehabilitation conference. This is our second one, and the theme is neurological rehabilitation. So if you've got more questions, you can ask Ben because they are exhibiting. They're actually silver sponsors of ours. So we have complete sort of virtual stands where you can interact, you can live chat with Ben. So the online Pet Health members, you guys obviously have free access to WebCon. Those of you that are not members, become a member, you'll get access, or you can purchase a ticket. Lots of thank you. Lots of people saying thanks, Ben. Thanks for your time. Enjoy the rest of your day. It's early for Ben, later for me. So it's like 5:30, 5:45, and you like 9 o'clock in the morning, aren't you, Ben?
I'm just starting my day, so.
Yeah. Cool, guys. Thanks so much for joining us, guys. And those of you that are listening to the recording now, please, if you have any questions, post them in the comment section, and I will get Ben to answer them. Thanks, guys. Have an awesome day.
Thanks for having me.
Bye.
Bye.